Greg asked me to speak today about violence against women, and I'm very grateful for the opportunity to speak to colleagues in the European Public Health Association and to bring the issue of violence against women onto the agenda when you're talking about sustainable development goals and healthy cities. So it's really lovely to be here. So thank you, Greg. By way of starting, just because I know that many people who work in urban health may not really have had much experience in the area of violence against women, I thought I'd start by defining what we mean by violence against women. And really most people still draw on the 1993 UN Declaration on the Elimination of Violence Against Women, which highlights that violence against women is any act of gender-based violence that results in or is likely to result in physical, sexual or psychological harm or suffering to women. And that includes threats of such acts, coercion or deprivations of liberty. And importantly, it includes both public and private acts of violence against women. It's a really highly prevalent experience, and usually when I'm doing a talk like this, including today, I do want to acknowledge that I realise this is something that will have affected people who are listening, whether that's women who've experienced violence themselves or anyone who's listening who may have experienced this as a child, or you'll have friends and family who've experienced violence throughout their lives. And I hope that the way I speak about violence today is respectful of that really difficult experience. It is a highly prevalent experience, and the statistics that's usually used is 1 in 3. So globally, if you look at the outcomes of the WHO multi-country study, which the initial study was done in 11 countries and then has been replicated in many other countries around the world, on average, around 1 in 3 women have or will experience an act of violence at some stage during their lives. In my own country, in Australia, and this is true in many other parts of the world, it's the leading cause of death and disability for women of reproductive age. As women age, obviously, in later life, other causes of death become more common, but it is a really important cause of death and disability for women across the globe. And violence undermines the achievement of all Sustainable Development Goals. So it is a big part of the focus of Sustainable Development Goal 5, but all of the other Sustainable Development Goals will be undermined while women are still experiencing violence in their daily lives. So when we're talking about Sustainable Development Goals, just to highlight for people that SDG 5 is around achieving gender equality and empowerment of all women and girls. And one of the specific targets for SDG 5 is to eliminate all forms of violence against women and girls in both public and private, and that includes trafficking and sexual and other types of exploitation. The 2 indicators for this target specifically look at 2 types of violence. And the reason they've been chosen as indicators is because we've got the best developed tools to measure these forms of violence compared to the other types of violence that women may experience in their lives. So the first one focuses on intimate partner violence, and that includes physical, sexual or psychological violence by a current or former intimate partner. And the second indicator focuses on non-partner sexual violence, so sexual violence that has been perpetrated by someone other than an intimate partner. And so that could be sexual violence or rape that occurs in a public setting, but also that may occur in private. Violence against women also is particularly relevant for other SDGs. So that could include SDG 11.7, which is safe public spaces, but also it includes a number of other SDGs as shown there on the screen. Oops, no, okay. So in thinking about researching violence against women, so obviously to collect data against those 2 indicators involves conducting research, and in particular prevalence studies, national prevalence studies, which are not easy things to undertake. And we've seen over the last few years, since countries have signed on to the Sustainable Development Goals, an explosion of interest in measuring violence against women, and yet very limited capacity, particularly in some of the low and middle income countries, to safely and ethically measure violence against women. So that's one of the things I want to speak a little bit more about now. When you're doing research on violence against women, it's obviously a very sensitive topic and can be quite a distressing thing for women to talk about their experiences of violence. It can stir up past trauma and re-trigger that past trauma. And it can also cause immediate safety risks for women. So if women are currently living with violence and tell researchers about that and talk about their experience, and the person who's using violence against them becomes aware of this, obviously that is a huge safety risk for that woman and potentially her children and extended family. So there are very specific ethical considerations when you're doing prevalence research on violence against women, or any form of research on violence against women, that wouldn't be the case for research on other public health issues. Prevalent studies around diabetes and ischemic heart disease, for example, don't have the same level of safety and ethical concerns as research on violence against women does. So over the years, and in particular here, full credit to WHO, who've developed guidelines and a whole range of resources on safe and ethical research on violence against women. And there are a number of principles that they highlight. Firstly, that the safety of participants and of the research team requires considerable training of the researchers. It's not a matter of just going through the questionnaire with a research team. It's really because most violence against women, not all, but most prevalent studies are done through face-to-face interviews. And so training of a research team about some of the scenarios that might come up during completion of a face-to-face questionnaire around violence, and how to handle things like participant distress, children coming into the room, an angry husband coming home and wondering why she's talking to some stranger about her private life. A whole range of things that might put either the participant or the research team at risk that requires considerable planning. And included in that planning is thinking about confidentiality. So in many other forms of research, you might advertise a study widely to try and increase response rate, or to get community acceptance of a study that you might be doing where it's a household survey involving face-to-face questionnaires. But in this instance, you don't want to advertise that the topic of a face-to-face questionnaire is violence, in case that inhibits some women being able to participate or causes risks within a household if it becomes known that one of the women in the household has responded to a questionnaire and everyone else in the household knows what that was about. There are other things to consider as well in terms of taking action to reduce participant distress at the time, but also ensuring that referral pathways are developed and planned for, so that if a woman discloses violence, and it may be for the first time that she has disclosed violence to anyone, that there's options for her. She may not want to do anything about it, and it may be historical violence, but even if it's current violence, it doesn't necessarily mean that she wants to pursue seeking services or law and justice interventions, but she does need to be left knowing her options by the researcher, and that's part of the responsibility of the research team in doing this research. As someone who leads researchers, teams of researchers doing this kind of work, it's also really important to take responsibility for debriefing and providing ongoing support to the research team who can be subject to vicarious trauma from doing this kind of work. And because women do take a risk when they share their stories, and their stories are painful when they're talking about experiences of violence, there's a real obligation that the studies we do are methodologically sound, properly interpreted, and are used to create change. And so one of the things that I'm involved in at the moment is the Novo Data Initiative, which is led by the UNFPA Asia Pacific Regional Office and has been funded by DFAT, the Department of Foreign Affairs and Trade from Australia, to try and build capacity in Asia and the Pacific to undertake safe, ethical and rigorous research on violence against women. As part of that program, the University of Melbourne has partnered with UNFPA and with Australia's National Research Organisation for Women's Safety to develop and pilot, and now run for several years now, a 4-week face-to-face intensive training to try and build capacity of national statistics officers, national women's machineries, organisations who are involved in research on violence against women in a range of countries in Asia and the Pacific. And just moving my slides. One of the things that we focus on in that training is on data literacy, as well as how to do the research safely and effectively, and lots of role playing. We also talk a lot about how to use and interpret data and how to use that in creating effective change. So one of the things that we might look at is a bunch of statistics here. I'm showing this map of the Asia Pacific region with all of the studies that have been done over the last 20 years in that region. So you can see that many of the countries have actually undertaken prevalence studies in at least one of the provinces of the country, if not the whole country. The beige larger balls, usually around the outside, that are the lighter brown colour, are the lifetime prevalence of violence. So that's the proportion of women who report that they have experienced either intimate partner or sexual violence from a non-partner over the course of, sorry, actually this is just for intimate partner violence, who have experienced intimate partner violence over the course of their lifetime. The orange balls in the centre are for those women who have disclosed that they're experiencing intimate partner violence over the last 12 months. So the outside balls are lifetime, and the inside is really current when you're thinking about last 12 months. And we use this kind of data to try and support participants in the course to think about differences and similarities across countries. So for example, if we look at Afghanistan, where the red circle's just gone up the top, you can see that when the most recent prevalent study was undertaken in Afghanistan, 51% of women reported that they'd had experienced intimate partner violence at some point in their lifetime. And 46% of women said that they had experienced it in the last 12 months. You could compare that to a country like the Marshall Islands, a very small country in the Northern Pacific, where 51% of women also reported that they had experienced violence in their lifetimes, but only 18%, well, only, still quite a large number, 18% of women reported having experienced intimate partner violence in the previous 12 months. So we work with participants to think about, well, what's going on in Afghanistan compared to the Marshall Islands, with same lifetime prevalence in the two countries. But what you can see is that in Afghanistan, once a woman has started experiencing violence, the sort of options or opportunities for her to leave that relationship and to escape the violence are very, very small. So most women, once violence has begun in a marriage, and it is usually a marriage in the context of Afghanistan, then they're stuck with that. There are very few options for them to leave a relationship, and there are very few services as compared to a country like Marshall Islands. Similarly, we might look at a lower prevalence country like Myanmar and compare that to Nepal, where in the last 12 months, both countries had an 11% prevalence rate over the last 12 months, but more women over the course of their lifetime had reported violence in Nepal. And then it would be important to look at the trends over time. Is this because things are getting better in Nepal, where there is increasing recognition of violence, there is increasing options for women, there are more services available, the legal protections for women are better than they may have been, say, in past decades? Staying with Nepal, where you've got a 25% lifetime prevalence rate, that is the same actually as Australia, where I'm speaking to you from tonight. So in both countries, 1/4 of women report that they've experienced intimate partner violence at some point in their life. But in Australia, only 1% of women currently report violence in their relationship. Now, working in the sector, I'd say that's definitely an underreport, but even so, all of these figures will be an underreport. Even so, there's clearly more options and services and opportunities for women to seek help in Australia as compared to Nepal. So that's the kind of exercise that we would do in that course, to try and build the capacity of participants to look beyond just the raw numbers and try and interpret them and understand what those numbers mean, and then use them for creating change in their own countries. And there's some great examples from Asia and the Pacific of people using research on violence against women to advocate for more funding for services and to really inform the design of their services. And I'm thinking particularly of countries like Vietnam, who've done repeated surveys now over time and really have used those to change the way the sector responds to violence against women. So measuring SDGs and the indicators is really important, but it's not everything. And there are things that missed if there's only a focus on measuring the SDG indicators. So some of the obvious things about what's missed are different forms of intimate partner violence. So if you remember back to the earlier slide, there was focus, when you think about intimate partner violence, it spoke about physical violence, sexual violence, and psychological violence. The behaviours that are recorded for physical and sexual violence are quite clear. For Psychological violence, there's perhaps less consensus across countries as to how you might measure psychological violence. And then for other forms of intimate partner violence, controlling behaviour, coercion, financial violence, there's even less agreement, and we don't have good tools for measuring those. And so they're not included in the indicator, but it doesn't make them any less important as really very difficult experiences for women to have that have a huge range of long-term impacts on mental and physical health and social and economic rights. So we miss some forms of intimate partner violence. We also miss non-sexual violence by other family members, carers and other members of the public. So you remember that the other indicator, the second indicator, focused on non-partner sexual violence, but that doesn't capture non-partner physical violence or emotional psychological violence that might be perpetrated against women by family members, that's parents or siblings, by their carers and by other members of their community. And I'm actually a qualitative researcher, despite having just spoken to you about prevalence research. And most of my research is with groups who are often missed out in a focus on SDG indicators. So I work in Australia largely with migrant and refugee women and women with disability, as I do in other parts of the Asia and Pacific region. And so the specific types of violence that migrant women, for example, might experience are not measured in these indicators. And there are particular forms of violence that particularly migrant women, perhaps more so than refugee women, but migrant women might experience that non-migrant women don't. So in Australia, that could be things like having your passports and all your immigration documents destroyed, or men who sponsor a woman out on a particular type of visa and then threaten to cancel that visa and have her deported to another country, or to take her children to another country, or have her deported without her children. So a lot of threats and controlling behaviours that are directly related to a woman's migration status. Women with disability experience particular forms of violence that other women don't experience. That could be things like destruction of assistive devices. It can be over-medication or under-medication. It can be neglect, being left without access to mobility equipment and also without access to food and water in some instances. So really, forms of violence that are at that intersection of gender-based violence, but also violence associated with, in the case of women with disability, of ableism, but it might also be at the intersection of forms of violence associated with racism or homophobia, ageism, if you're thinking about elder abuse, colonisation. The levels of violence against Indigenous women in Australia are substantially higher than they are against non-Indigenous women. The violence that occurs against women in conflict settings, a whole range of other factors. So SDG indicators really important, but they don't capture all of the forms of violence that women experience, and they particularly are not sensitive enough to capture the specific forms of violence that some women will experience. And they don't capture state perpetrated or state sanctioned violence, and certainly working with migrant and refugee women, that's something that's always very at the forefront of my mind. So it can mean that the experiences of particular groups of people are invisible in the data that we collect, but also therefore in the responses that we design. And the meanings that women attach to their experience and the contexts in which it occurs aren't captured. And this is really important at the moment when we're thinking about the impact of COVID-19 and the rest of this panel talking about safer cities. People being asked to shelter in place or to stay at home at the moment. Home's not safe for many women, and we know globally we're seeing an increase in help seeking from women who are being sort of isolated in place with a violent partner, and the impact of the social isolation measures that are being taken in response to COVID-19 for women who are living with violence. I just thought, I'll go back, just being a qualitative researcher and knowing that the experiences of particular groups are sometimes invisible and that meanings and contexts aren't always captured, I just thought I'd share some work that we've done with migrant and refugee women in Australia and some work with women with disability in the Philippines about alternative methods of showing their experiences of violence. I worked with a group of migrant and refugee women in Victoria, in Melbourne, in Australia. And actually, we also had some participants come up from Tasmania. And these were women who had direct experience of violence or who were advocates in their migrant or refugee communities in relation to violence. And they used photo voice, so taking photographs and writing captions to share what they wanted to say to their community or to the general public about their experience of violence. And what they wanted to talk about was often quite different than the data that we would have got in response to our question guides and the interviews and focus groups that we ran. And they were certainly quite different messages than you would be able to get from a prevalence study. So Kelly here has taken a photograph of the public housing where she used to live when she was experiencing a lot of violence. And I really like this photograph. She went back to take photos at the place where she was living when she was in an extremely violent relationship. And in fact, found when she got there that she became quite distressed, had a panic attack. And so the photo is quite blurry, and she deliberately wanted it included in a big exhibition we had of their images, because she said that the blurriness represents how she felt going back. And she says that it's hard realising it's been so many years, but the feelings are still there. Kelly was subject to, she'd left that violent relationship more than 10 years prior to this photo being taken. And I think it is a really good illustration of the long-term mental health impacts of violence on women and their children. This is another one of Kelly's photos. She was a fantastic photographer. In this photograph, she just took a photo on her phone and then used a filter to Photoshop it to make her handson, as she describes it, look dead. And the message she was trying to communicate here is what it feels like as a mum going through the court system, the family court system, with a child when you are trying to leave a violent partner. In that she felt like she was being forced to let go of her child the whole way through. I've shown this photo as part of a wider exhibition of migrant refugee women's photographs at conferences of magistrates of the court system and so on. And this photo, I've seen, hard-hearted judges get quite teary over this photo. And I think it speaks to the power of qualitative data and visual data to show how people feel in the domestic violence response system, which is something that can be quite hard to get from statistics. Yan, who's was one of our Chinese participants, took this photograph as an illustration of the difficulties migrant women have in seeking help and telling their story, in that they're seeking help from a system that they don't understand, where there's so many layers of bureaucracy in the health sector, in the law and justice sector, in the specialist domestic violence services, in mental health services, counselling services, drug and alcohol services, housing services. Each time they're being asked to tell their story again, and it's a difficult story, and they don't know what's going to be on the other side of the door when they reach for help. And sometimes when they get to the other side of the door, it's another door or it's a brick wall. And so she was taking that photograph to perhaps try and communicate that experience of seeking help and looking for a way out of a very difficult situation as a migrant living in a new country. And then just finally, a photograph. This is from a completely different project that was with women with disabilities in the Philippines, where we did research over a number of years with women with disabilities about sexual and reproductive health and their experiences of violence. And it was an action research project where we then took the initial data and developed pilot interventions. One of the interventions that we developed was peer support groups for women with disability, and this is a photograph of one of them there. And I include this photograph because it's a nice illustration that we did a lot of work in this project to try and improve service providers' knowledge and attitudes around women with disability and the violence that they might be experiencing, to try and increase the physical accessibility of services, making sure that there were ramps and doors that people with mobility impairments could get through, that sign language interpreters were used, and so on. But in fact, the peer support groups were really what helped women think through their own situation, recognise that they did have rights, and that they often supported each other to try and access the law and justice for their experiences of violence. So I'm going to stop sharing my screen now, and I will pass to Greg to see if there were any questions that people wanted me to respond to.
Yes, thanks very much for that important presentation there. We have had a few questions, as I'm sure you can imagine. Quite a few have come out about the pandemic, but more specifically, somebody would like to know your thoughts were on the implications of changing from face-to-face to telephone and on the safety of taking part in research as a result of the pandemic.
Yeah, so there are pretty specific considerations in doing research over the phone and online in relation to violence against women. So some countries always have done their national prevalence studies over the telephone. Italy comes to mind. Canada is another country that does a national prevalence study via the phone. And so there are guidelines on how to do that as safely as possible. And one of the first things is making sure that you've got a system set up so that you're able to contact someone in advance and check that it's an okay time for them to speak, and contact them in a way that doesn't give away to anyone else who might be monitoring that phone what the call's about. So it is quite difficult to do that safely, but there are resources certainly available, and Greg, I'd be happy to send you afterwards some list of resources about how to do, how people have done that before to make that as safe as possible. Certainly what we're seeing in Australia is it's interesting. There's been a drop actually in requests for help over telephone lines to not all, but many of the services, but a substantial increase in requests for help over the online chat type services. So that's making us think that obviously women are able to send a text or be using their phones to be seeking help if it's not audible, but they're having difficulty safely seeking help using the telephone. The other thing that we have seen is a substantial increase in requests for help from men who are worried about their use of violence or concerned that they might be going to use violence, and we just do not have enough services working with men and who use violence for perpetrator programs. There aren't enough of them, and that's sort of a major challenge that we're seeing at the moment.
Yeah, and so we've probably got time for another couple of questions before we move to Amit. Another question that came up was about how you change your research methodology for hard to reach populations.
I'm a big believer in using as participatory approach as possible. So working in close collaboration with hard to reach, which sometimes can be kind of easy to ignore populations. So when I work with migrant refugees in Australia, I don't have a migrant and refugee background. So I work very closely with the Migrant Women's Health Organisation, who have a team of bilingual workers, and we've trained a group of 20 women to undertake qualitative research in their own languages. And we find that giving women a choice of how they want to engage in research, whether it's in their own language or in English, increases their both willingness to participate, but also the depth of information that we're getting. It's not always that people want to do it in their mother tongue. And I think there's something about the psychological distance of being able to respond in a second language that keeps you a little bit distant from painful experiences. That means that women sometimes would prefer to do it in English, even if their English is not fantastic. But I think women should have the choice, and that should be done with community organisations who can tell you all the pitfalls and all of the kind of cultural faux pas you're about to commit before you do so that you don't lose trust of communities. Similarly, with women with disability, we always work in partnership with disabled people's organisations who often will ask quite different questions than what I would have thought of as a researcher on violence against women. I've learned a lot from DPOs around things like carer violence, the realities of being so dependent on a carer for day-to-day support, and what that might mean if that carer is someone who uses violence against you.
Thank you very much. And I think we'll just have one last question that's just come in on Twitter, again about COVID-19. What has been done to evaluate country responses to increases in intimate partner violence during the pandemic?
Yeah, so there isn't a lot of data yet about the effectiveness of responses, but there's a lot of data being collected. So we know from China, from the UK, from the US, Spain, Italy, Russia, increases in requests for assistance. the evaluation of interventions, I haven't seen a lot of data as yet about the effectiveness of those interventions, but I certainly know here in Australia there's sort of a lot of documentation of different approaches that are being taken. The prevalence of COVID-19 is much lower here than it is in most parts of the world, for which I'm incredibly, it's partly good decisions, but partly luck, and may not stay that way. But the impact of the social isolation measures is substantial in relation to violence against women. So there's certainly data being collected about, online approaches to reaching people, apps that people might have on their telephones, and how people can use those safely when the phones are being monitored by people who use violence, and other strategies around in terms of neighbourhood surveillance and more kind of mutual assistance that local communities are using to support each other and keep an eye on women where they may be concerned that they are at risk of experiencing violence.